What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my pathology playlist. In previous videos, we talked about cell adaptation, cell injury, and cell death. We discussed atrophy, hypoplasia, hyperplasia, hypertrophy, metaplasia, dysplasia, and neoplasia. And we divided neoplasias into benign tumors and malignant tumors or cancers. We covered hypoxia versus hypoxemia and the different types of hypoxia and the different causes of cell injury. We talked about apoptosis and necrosis, the 3 mechanisms of apoptosis, and the 6 subtypes of necrosis. After that, we talked about the complement system, the hypersensitivity reactions, acute inflammation, cytokines, interleukins, and inflammatory mediators. Today, we shall talk about such a mediator, which is known as bradykinin. There is a rule in medicine that says if it ends in IN, the odds are it's a protein or at least a peptide. Bradykinin is a peptide. Why do we call it bradykinin? It literally means slow motion, which is very relaxing. You know what else is relaxing? The smooth muscles of the blood vessel. So the blood vessel is going to dilate. Bradykinin is a vasodilator. Now let's get started. Click the like button, click the subscribe button before I start swelling. This is my pathology playlist. Please watch these videos in order for maximum understanding and retention, not to be confused with my patient's urine retention. A quick review of inflammation. We have 2 types of inflammation, acute inflammation and chronic inflammation. Who are the heroes of acute inflammation? Your neutrophils, aka polymorphonuclear cells. What are the heroes of chronic inflammation? Your lymphocytes for the most part, i.e. the mononuclear cells. The outcome of acute inflammation is A, resolution, or B, progression into a chronic inflammation, or C, abscess formation. The abscess is a collection of pus, and the pus cells are, you guessed it, the neutrophils. What are the sequelae of chronic inflammation? I can leave a scar, I can make you disabled, or I can give you secondary amyloidosis. I've talked about amyloidosis in a separate video in this pathology playlist. The video is titled Amyloidosis. Acute inflammation. What's the problem? The problem is that your body has been invaded with microorganisms, for example, bacteria. These bacteria are not located inside the cells. They are not located in the blood, but rather they start in the interstitial space. Now, we would like to fight these bacteria, but the problem is that your neutrophils are in the blood, but the bacteria is outside of the blood vessel. So what should we do? We should push the neutrophils away from the blood and towards the interstitial space. How does that happen? In several steps.